Sepsivac for COVID-19. Sepsivac, a drug jointly developed by the Ahmedabad-based Cadila and the Council for Scientific and Industrial Research (CSIR), will be tested in 50 COVID-19 patients at the All India Institute of Medical Science in Delhi and Bhopal and PGI Chandigarh. Sepsivac. The Council of Scientific and Industrial Research (CSIR), through its flagship New Millennium Indian Technology Leadership Initiative (NMITLI) program, has been supporting Cadila for developing a drug to save lives of critically ill patients suffering from gram-negative sepsis. This entire development effort has been supervised by CSIR appointed monitoring committee. The drug has been shown to reduce mortality of critically ill patients by more than half. It also leads to faster recovery of organ dysfunction seen in sepsis patients. It has now been approved for marketing in India and is commercially available as Sepsivac from Cadila, currently in trials for the treatment of critically ill COVID-19 patients. The drug contains heat-killed Mycobacterium W. It is found to be extremely safe in patients and no systemic side effects are associated with its use. It can be used concurrently with any other therapies required in the management of such critically ill patients without any restriction. Its unique properties include boosting protective immunity, which is Th1 and TLR2 agonist, and suppressing non-protective response Th2. This drug can help boost the immunity of our body so that this cytokine storm does not take place. It does so by activating what is called a Th1 pathway, which helps our body to generate a very specific immune response against the virus. In short, it increases our ability to fight the infection. Sepsivac was originally developed for treating sepsis by a class of pathogens called gram-negative bacteria that are known to cause life-threatening infections. Given the similarities in the immune system response in critically ill COVID-19 patients, it is theorized the therapy could stimulate a benign response. A large quantity of cytokines, chemicals signaling the presence of an infection, are produced in the early stages of the body's response against an infection to stimulate the production of antibodies. However, cytokines also cause inflammation of organs and can be counterproductive in protecting the body. Keeping them in check is the goal of so-called immunomodulators or medicines like Sepsivac. Previous randomized trials in sepsis patients showed 11% absolute reduction and 55% relative reduction in mortality. Sepsivac reduces the days on ventilator in ICU and hospital and incidence of secondary infection. In gram-negative sepsis as well as in critically ill COVID-19 patients, there is an altered immune response leading to a massive change in their cytokine profile. The drug modulates the immune system of the body and thereby inhibits the cytokine storm, leading to reduced mortality and faster recovery. As of now, there are no confirmed drugs or vaccines against COVID-19, though several clinical trials are underway. This is Sepsivac. It is Mycobacterium W heel-killed injection in a colorless opaque suspension in which Mycobacterium W cells are suspended and having tendency to settle down during storage. Each 0.1 ml contains Mycobacterium heat-killed bacilli with preservatives. The dosage: Mycobacterium injection is a sterile suspension for intradermal injection. The strength of the heat-killed injection is 0.5 into 10 to the power of 9 cells per 0.1 ml. The recommended site for the MW heat-killed injection Sepsivac is at the insertion of the deltoid muscle near the middle of the left upper arm. Sites higher on the arm are more likely to cause keloids, the tip of the shoulder especially. For cosmetic reasons, a scar on the upper and lateral surface of the thigh may be preferred, and this is an alternative site. The upper arm must be approximately 45 degrees to the body, and this can be achieved if the hand is placed on the hip with the arm abducted from the body. The skin should be swabbed with spirit and allowed to dry. It is advisable to use 26 or smaller gauge needle. The operator stretches the skin between the thumb and forefinger of one hand and with the other slowly inserts the needle with the bevel upwards till bevel is fully in the demicis and not visible out. The needle can usually be seen through the epidermis. A correctly given intradermal injection results in a tense, blanched, raised bleb, and considerable resistance is felt when the fluid is being injected. A bleb of typically 7 mm diameter follows a 0.1 ml injection. If little resistance is felt when injecting and a diffuse swelling occurs as opposed to a tense blanched web, the needle is too deep. The needle should be withdrawn and reinserted intradermally before more is injected. The subject must be advised of the normal reaction to the injection. The second dose of injection is to be given 1 inch apart from previous dose to minimize the chance of a local reaction. Following intradermal administration, normally a local reaction develops at the immunization site within 2 weeks, beginning as a small papule which increases in size for a few weeks, widening into a circular area with scaling, crusting, and occasionally bruising. Occasionally, a shallow ulcer develops. It is not necessary to protect the site from becoming wet during washing and bathing. But should any oozing occur, a temporary dry dressing may be used until a scab forms. It is essential that air be not excluded. If absolutely essential, an impervious dressing may be applied but only for a short period, since it might delay healing and cause a larger scar. The lesion usually subsides over several months and eventually heals, leaving only a small flat scar. Sepsivac for COVID 19, the emerging drug trial in order to heal mankind of this terrible scourge. Sepsivac for COVID 19 patients.